Hi, it's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. In last week's blog I talked about 5 things you need to do when you're not present when the doctors are making crucial decisions when your loved one is critically ill in intensive care. You can check out last week's blog by clicking on the link below this video. In this week's blog I want to talk to you about how you can turn things around by having a loved one critically ill in intensive care on your terms. Before I get into today's topic, I want to share a quote with you that I wrote on this topic, and the quote says, "You should think of life as a lifelong, constant and never-ending process of successful negotiation to create and maintain the life and lifestyle you've always wanted for yourself and for your loved ones. This mantra shouldn't change even when you're facing adversity, such as when your loved one is critically ill in intensive care." Most families of critically ill patients in intensive care are usually missing the point, and they are too afraid to ask for what they want and deserve for their loved ones. They are too afraid to challenge the status quo, and they are too afraid to challenge the perceived power and the perceived authority of the intensive care team. This approach usually backfires without families in intensive care realizing that they are giving away their power. Having a loved one critically ill in intensive care can be on your terms if you are prepared to challenge the status quo. Ask the right questions. Do your own research. Don't take no for an answer. And overall, take a different and counterintuitive approach compared to the 99% of the families of critically ill patients in intensive care who don't make informed decisions, don't have peace of mind, don't have power, don't have control, and don't have any influence. It's like a bazaar of life with endless streams of people and circumstances trying to sell you on why you should do what they want you to do, or on the other hand, you selling them on why they should do what you want them to do. The choice is yours which approach to take. Sometimes a deal can't always be made. Great deals are made with the win-win or no deal philosophy. When terms are not to your liking, don't settle. Walk away, never look back, and continue seeking and searching for what you want. Success only releases its reward long after you thought it would have, and after pretty much everyone else has long since given up. Doing things that are difficult can take a long time to accomplish, whilst things that seem impossible usually just take a little while longer. Whilst critical illness in intensive care often comes with massive time as well as resource constraints, there is no such thing as giving into what other people want for you and for your critically ill loved one if you feel it's not the right thing to do. Getting treatment, care and outcomes to your liking and on your terms is simply a matter of positioning yourself and your critically ill loved one in the right frame of mind and getting things done on your terms. So, let's get into today's topic. If your loved one is critically ill in intensive care and is in one of the following heartbreaking, difficult and challenging situations, where they are either very unstable and in a very critical condition, or they are in a life-threatening situation, or they're not waking up after an induced coma, or they are in intensive care for long-term treatments and long-term stays, including long-term ventilation, or your loved one may be having a severe or traumatic head or brain injury, or they may be threatened with an NFR, not for resuscitation, or DNR, do not resuscitate order, or they may be in a situation where the intensive care team suggests a withdrawal of treatment or a limitation of treatment as being quote-unquote in the best interest for your critically ill loved one. Or your critically ill loved one may even be approaching their end of life in intensive care. The reality is that during those difficult, challenging and often heartbreaking situations, it's very easy for the intensive care team to dictate the terms, or so you think. It's very easy for the intensive care team to dictate the terms because they believe they can. However, what's probably worse is that 99% of the families of critically ill patients in intensive care who don't make informed decisions, who don't have peace of mind, who don't have power, don't have control, and don't have influence, are simply believing that they have to accept those terms. The good news is that unlike signing a contract for a new property, for a new car, or for an insurance, you don't have to sign anything when your loved one is critically ill in intensive care. Therefore, you are not obliged to agree to the terms the intensive care team is presenting you. If your loved one is critically ill in intensive care, you need to very quickly get to the bottom of the things and the issues that are happening in intensive care. And you need to very quickly establish a frame of mind that is distinctly different from the 99% of the families of critically ill patients in intensive care who don't make informed decisions, who don't have peace of mind, who don't have power, don't have control, and don't have influence. Easier said than done, because if you look around in intensive care and you see those 99% of the families of critically ill patients in intensive care who don't make informed decisions, who don't have peace of mind, who don't have power, don't have control, and don't have influence, it's much easier to copy their behavior rather than doing your own research and looking at what needs to be done in order for you to get the results and in order for you to have the intensive care treatment for your critically ill loved one on your terms. The fact of the matter is that if you copy the behavior of the 99% of the families of critically ill patients in intensive care who don't make informed decisions, who don't have peace of mind, who don't have power, don't have control, and don't have influence, you will get the results that the 99% of the families of critically ill patients in intensive care are getting, and that's bad news. The fact of the matter is that if you don't take matters into your own hands, if you don't do your own research, and if you don't start asking the right questions, the intensive care team will do whatever they like. They will treat you just like a number, and they will do things on their terms. The reality is that intensive care is such a complex, highly volatile, highly political and dynamic environment with way too many moving parts behind the scenes that you can't really afford to buying into any terms that you don't like. And you may well wonder, how would I know? Well, after more than 15 years intensive care nursing in 3 different countries, where I literally worked with thousands of critically ill patients and their families, and where I also worked as a nurse unit manager in intensive care for more than 5 years, I have literally seen the difference between the very few families of critically ill patients in intensive care who make informed decisions, who get peace of mind, control, power and influence, and they are simply prepared to do whatever it takes to get the terms that they want, compared to the 99% of the families in intensive care who don't. In fact, I created an ebook, and here's a link to it, to a very valuable resource that will give you even more insights into how you and your families can get what you want. You can check out the 5 things families do who have peace of mind, are in control, feel powerful and influence decision making fast whilst their loved one is critically ill in intensive care. Check out this ebook by clicking on the link below this video in the written version of the blog. On the other hand, if you start doing your own research, if you start acting differently, if you start asking the right questions, and if you start to even become difficult and demanding, you will see very quickly that the terms the intensive care team is trying to dictate to you are in fact negotiable. I have just come off a consulting session with a client yesterday, and the client was telling me that the minute the intensive care team realized that the client had done their research and they were asking all the right questions with confidence, they actually asked the client whether they were a doctor or a nurse. The treatment the client and their family member received from the intensive care team changed very quickly and rapidly. Point in case, do your own research, speak to the people who know intensive care inside out, and you'll have massive leverage at your hands. You get what you want, and you don't need to settle for terms that are not to your liking. So, how can you get the terms of your liking, become the best advocate for your critically ill loved one, and make informed decisions? Get peace of mind, control, power and influence quickly whilst your loved one is critically ill in intensive care. You get to that all-important feeling of making informed decisions. Get peace of mind, control, power and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn quickly how to get peace of mind, real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions. Discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle and vulnerability even if your loved one is dying. You get 5 mind-blowing tips and strategies helping you to get on the right path to peace of mind, control, power and influence in your situation. You'll get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You'll get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care. and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's blog, and I'll see you again in another update next week. Make sure you also check out our Your Questions Answered section, where I answer your questions, or send me an email to support@intensivecarehotline.com with your questions. Or you can call me. Find international phone numbers on our contact tab. Also check out our ebook section, where you get more ebooks, videos and audio recordings, and where you can also get one-on-one consulting with me via Skype or over the phone, and via email by clicking on the email and phone counseling tabs on the top of the website. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.